Welcome to today's session with Napier on advanced technologies that will improve and drive your home care and residential care businesses. As we know, the aged care system is growing exponentially across the world. So the challenges and drivers are not unique. However, what is happening is that we are seeing how technology can make significant inroads to both improving and driving a better outcome for your provider business. So in today's session, what we're going to do is explore some of the technologies that you may have already been using in different parts of your life, but may not be aware that we, organisations like Napier, have been using that and infusing that into our technology. So Napier's been around for over 22 years, and we've been mainly working in the hospital, patient administration, health information system area. And that's where we harnessed our strength in quality of care and care platforms from in that hospital setting. And a number of years ago, we extended that environment to support daycare, retirement villages, and home care. And from our initial inception in that product redevelopment phase was that we focused on an architecture, a platform that would allow us to infuse and embed changing technologies, changing capabilities that traditional systems built in a monolithic way found it very difficult to adapt and evolve and take advantage of the new capabilities out there. So in today's session, we're going to explore how, with an architected platform, how we can infuse and leverage technologies such as artificial intelligence, machine learning, great data insights that we can get, and then how we can use mobile capabilities to be able to both drive efficiencies without sacrificing quality and care. So within the environment today, we have a number of challenges for care providers. In this consumer-directed care world, we need to be able to manage to a budget. We're managing to clients that have ever-changing needs. As a home care provider, you've got to provide a range of services or focus on a particular niche as an example. So you might be doing some clinical care, nursing, wound management, right through to the gamut of home help and care support services and everything in between around an allied care environment such as physiotherapy, podiatry, occupational health, etc. And so from your point of view, being able to attract and attain the right sort of customers that fit your business to the budget that they have and managing that without significant overheads to your business is a critical performance factor for how you run your home care business or your residential village as an example. At the same time, around the world, the requirements around governance and compliance and auditing has grown. We want a transparent capability in the industry so that we can show that we're delivering the care, supporting those people with disabilities, Alzheimer's, or just the elderly, and leveraging best practices and processes. But at the same time, that overhead of governance and auditing shouldn't be dragging down your business. If the system can capture and meet those audit requirements in an efficient manner and save you the work, manual intervention, people and manual spreadsheets and documents, then and still meeting those audit requirements. And at the end of the day, how you measure the effectiveness of your organisation is being able to deliver repeatable quality services in the most efficient manner as possible. So how do you do that? It's about having the right staff, retaining and keeping the right staff, giving them the right tools so they can focus on what they do best and less on administration. Making your catalogue of services easy to understand and consume, to the clients, to attract the right sort of clients based on your business model. And as I said, the range of services is growing significantly. More and more governments and countries are trying to enable organisations to deliver services so that people can stay home longer and not to clog up the hospital system or clog up beds in residential nursing homes if they at all exist. And so therefore being able to have services and have a system that supports both those wellness type services, everything from cleaning to health, disability, right through to clinical and allied care. And how do you do that and maintain the quality and efficiency that you're driving for? As I said, there are many key challenges both facing providers as well as the industry. And I guess the key one here is the increased cost of care. Retaining, keeping the right staff is another critical aspect. There's a constant staff shortage. There's also, that balance of finding someone that has the right skill, the right flexibility, the right capability, but also how do you manage that cost of care, cost of delivering that care, both if in a mobile setting, how do you get efficient planning? And then secondly, how do you retain and keep and grow that staff that you've acquired and then are making significant inroads into your operations? At the same time, as I said, between compliance, governance, range of services, and demands that consumer-directed care has, it's just making things more complex. So how do we utilise technology to give us the benefits of simplicity, but also maintaining and managing complexity? So I'm going to go run through some of the key areas where we can see technology has been infused into different portions of the care continuum. So I guess the first one was talking about how do you, if you've got a marketing campaign or a marketing site, how do you attract the best fit client based on where you are? If you don't have a dashboard to see which services are underutilised, which services are overutilised, which staff with certain capacity, how do you attract the best fit? How do you allow self-service to be able to a customer to say, look, I need a lot of physio, and yet you've realised at the moment you don't have any capacity in physio. You want to retain that customer. You want to get that lead to say, yeah, okay, I need to grow my physio business. I need more staff. Is this the right time to take on this additional client, or vice versa, where you have a huge amount of capacity and you want to be able to promote that? The system should be telling you and giving you KPIs all the time about what the system and what your organisation is doing. Secondly, you might be running a membership model where you're financing and attracting clients to join as members to consume different ones of your services around a membership package. You might be selling it as one-off services, but you're doing it through a 3 month, 6 months, 12-month contract. How do you manage that estimation, that budgeting estimation? How do you do that forecasting to make sure you have the right capacity that you're as you're acquiring new patients and clients? Does that fit in with your financial model? Do you have the right capacity? How is your system today supporting you in those sorts of business decisions? So in that whole pre-admission enrolment assessment, how do you get a good view as to what this client wants? How does that match your business? As well as being able to offer social and financial counselling to help them understand how they can consume this service through paying for some of it directly, whether there's any government rebate, or it's through certain insurance groups that are more favourable for those sorts of services. Secondly, how do we engage our clients' family and next of kin environment? Do we have a smart portal that is sharing either very finite from a security paradigm point of view, or more extensive pieces about what's happening with their relative who is at home receiving care. How do we track and let them know about what's happening around transport, what sort of visits they're consuming, how's their care plan, what's happening, has there been any incidents or any issues, how's their trajectory of their wellness program, if their wellness is about movement and general health, is it improving? Are we meeting that outcome? If it's around vital signs such as blood pressure and blood glucose, oxygen levels, what's the trajectory? How do we share that? So do you have a clever portal strategy to allow customers to see that? And does it provide for self-service? So we're going to talk about technology such as chatbots and live chats, and how we can extend the system to provide smart information in a self-service way that allows you to get on with your business, clients to be able to get the information they need, and then proactive triggers to alert them about what's happening through the use of smart technology. In the care and services management point of view, if any of those assessments or those wellness pieces aren't on track, can we automatically today trigger a reassessment? Can we automatically trigger an appointment to say, well, this person's vital signs are deteriorating, so therefore we need to automatically schedule a specialist clinical person to follow up on that particular piece? And how do we then forecast that and manage and organise both the transport, the assignment of that person, and drive efficiencies in our business? Or are we managing multiple diaries, multiple calendars, lots of emails and phone calls to get that sorted, and then therefore at the end of the day we're unable to meet our agile needs to be able to update care plans to support any future audits and so on and so forth. So being able to, if there's an issue, and I'll use this example a few times, if there's an incident on site during a physio piece, or the physio has arrived and there's been some sort of issue, how do we orchestrate that closed loop to address that incident and track and manage that to make sure it gets managed, as well as notifying your care providers and as well as your next of kin. At the same time, if we've got a mobile workforce, how do we, and delivering different services from diabetes management to other chronic morbidity diseases, right through to wellness and support and physio? Do they have all of the right equipment to be able to do that job? How do we orchestrate that, and how do we manage that? Does having a stock procurement and supply management capability tied to the service and tied to the delivery of that client, automatically orchestrating the delivery of those supplies if we know that care worker doesn't have it in their car, and orchestrating all of that, and then automating the check-in and check-out of those items so that we know what's stock on hand, what's being consumed, making sure that it's being billed for and consumed appropriately. From a budgeting and finance point of view, as I said from the beginning there, if you're running a membership model or a subsidy or a discount model based on consuming a certain number of services or different styles of services, some that are insurance supported, some that are privately paid, some that may have some government subsidy or some sort of community subsidy. How much time and effort does it take to manage those budgets, track those financial management, and then provide transparency back to the client as well as to the next of kin or relatives that may or may not be contributing to that? If somebody's assessment or health or wellness degrades, how do we automatically trigger a reassessment so that we can then notify insurance that they've moved to the next level of care, and so that their claims are going to be increased? And how do you make sure that you're putting in the right claims with the right evidence so that you're paid promptly and there aren't queries and challenges against those particular pieces? And ultimately, how much overhead does this have against you and your business? from a staff scheduling and rostering, route management point of view, you've probably got some sort of rostering capability today. You're managing multiple diaries, managing multiple schedules. You've got clients who've got different preferences. You then have to look up and make sure, you know, someone may want someone to deliver that service who speaks French or speaks a certain language. They only want a female. They only want to deliver the service on Wednesday and Thursday mornings, as an example. How do you coordinate that? How do you do that efficiently? At the same time, be able to organise your routing and tracking of staff visits so that they're doing the most efficient route that makes sense. How does your system do that today? Is there a lot of manual overhead? How do you reduce the administrative overheads of people delivering care services at home and having to manually fill out spreadsheets or fill out pieces of paper or do a lot of typing on a keyboard or a lot of touch typing on a smartphone? There are other ways, and we're going to talk about that with some examples about that in a moment or two. So as I said, the care market has a huge array of drivers. You know, one, obviously, there's an increased demand for services, and then the complexity of those needs. We want to be able to balance, and as I said, our history is around delivering services based on quality metrics. When you're delivering services in a hospital setting, it's all about the quality and being able to measure that quality. To some extent, a little bit less in a nursing home or a residential facility. That's still very important. When you're moving into the broad set of help services, transport, gardening, massage, etc., that in the home care environment, it's all about efficiency, but quality of care. If you want to expand those services, now you've got a balance between, you know, one day having a nurse delivering wound management, some right through to basic respite care, right through to massage or podiatry services. So we've got a huge shortage of trained staff, and at the same time we've got a very different, challenging landscape for how we can claim and get paid for in this world. So just for a moment, I want you to think about how many times a day or a week you are using technology. Who's talking to their phone today through Siri? Who's using Alexa or Google to ask it to read out something, display your diary, show a menu item or a recipe? How efficient would Uber or Ola be today if it didn't empower its drivers to run their own business right from their phone, to efficiently navigate certain areas, to optimize their routes, optimize their ability to acquire new clients and manage all of the billing and reimbursement and payment pieces, as an example? How many times a time do you go onto a website and you're hit with a live chat or a chatbot to say, how can I help you? And you can ask it a series of questions and etc. So as I said, we took the view years ago to have an architected platform with a series of engines. And that's given us the ability to infuse everything from Ola and Uber style technology, Airtasker, chatbots, natural language processing so that we can talk and capture data in a meaningful, intelligent way. So we've infused a number of those different technology elements, all supported around an artificial and intelligence framework to give us those sorts of capabilities that you're used to in other pieces but aren't typically being used in the health sector. So as I said, there's changing needs. You know, we want to grow. If we want to grow our business, or we just want to be able to package our services in ways that make sense, both from how we talk to the market about what services we offer, and secondly, we want to bundle packages together so to support various different ways that we want clients to interact with us, either through memberships or some sort of subscriptions. But today, do you have an extensive ability to define those services, define those eligibility rules, define a service that clearly says requires qualified clinical care to deliver that service, right through to non-clinical services with very different skill sets. So now you can see, once we have that ability to create a catalog environment of services, we now have, and with a whole host of attributes that describe that services, and then a whole set of eligibility rules, we now have a powerful engine. We can then work into both predict which services are needed, which services can be used, and then tie in services to the right staff member, to the right client preference. As I said, one of the challenges we have is retaining and keeping staff, finding staff. So if you've got this huge array of catalogue services from clinical to non-clinical, you now want to be able to have a database engine of your staff. You want to be able to categorise your staff right down to their skills, their qualification, what soft skills they have. Do they speak multiple languages? What sort of cultural areas can they help with? What are their preferences around travel distances, locations, days of the week? You want to be able to keep that staff occupied and busy for the days that they want to work with you, and also be able to, if you need to stretch your services, find out at a pinch what day or times can they be flexible. Once you've been able to capture all of that, the need to ring them and on a daily basis to change things, etc., means that our system now has this extensive catalogue of services, well defined, with lots of attributes. Now we've got a database of our providers, both staff and contractors, with all of the attributes, and then finally we can then optimise the visits that they make. If they've got multiple skills or they can deliver multiple services, we can start streamlining our processes and achieve operational efficiency. Once again, we've embedded the technologies from the courier companies. If you can imagine how many diverse trips every courier company does on a daily basis, and that if they didn't have a very efficient way of delivering parcels of different sizes, of different types, different complexities, temperature-based, size, shape, etc., they wouldn't be able to manage that business. So taking the courier aspect, I guess the Google Maps piece, as well as the Uber piece, we've infused that technology into how we orchestrate a very streamlined process for efficient delivery and of services. As I said, around the clinical side, it's primarily around efficiency, around quality of care. But when you're delivering non-clinical, it's about efficiency. How do we get greater efficiency out of our staff? How do we reduce the administrative and manual and paper piece burden? How do we organise and orchestrate inventory and billing so that it doesn't become a burden on both the carer or the business? How do we push out procedures and processes to a carer so that when they visit, if they haven't performed that particular process before, haven't delivered that service before, how do we maintain the quality of care? So can you today push out an electronic checklist that guides them through what to do, a little video that shows the procedure that they need to do? How do you allow them to update the care plan and also meet your audit requirements? How do you then allow them to manage and support an incident or support a client who has had an incident, and you want to be able to auto-recommend what activities and what tasks need to be carried out? I guess, as I said, from a quality processing point of view, we always want to ensure the integrity of our care services, whether they be clinical or non-clinical. So being able to, as we are using in some cases, remote devices to capture vital signs such as blood pressure, blood glucose, oxygen levels, movement, fall management, etc. how much of this can we automate or supplement to the care? One, it differentiates us in the market to say that we can provide remote care. At the same time, we can also provide a broader range of care services and also allow people that may not have the skill to be able to support capturing and supporting our clients, whether they have the direct skill or not. So we're going to sort of move into a little bit of demystifying, I guess this is the image of artificial intelligence and machine learning, this sort of robotic image of someone that's free thinking but far more efficient than a human, and so on and so forth. So if we can step away from that for a moment and let's look at some real examples for how artificial intelligence is used particularly in our health and wellness care scenario. So we've used artificial intelligence to automate the routing and work tasks based on, we now have in a system a comprehensive database of services. We can see which service has been used, by when, by whom, who delivered it, what was the satisfaction level, what was the consumables used as part of that service. So that anytime a new service request comes in, the artificial intelligence engine can start doing some predictive service requests. It can start doing some forward planning, saying that we know that Mary delivers services Wednesdays and Thursdays in the northern part of the city, and she always has a bit of capacity for taking on new requests. So as soon as a new request comes in, it automatically checks her route and, if necessary, changes her route where there's some flexibility and can make those appointments. At the same time, it can start doing future predictions for what is the service utilisation of both that service and those practitioners or care workers, and starts predicting where our load and load balancing needs to occur. Do we need to bring on more staff during a certain time of the day? Do we need to attract more people of a certain skill set as we grow our physio or our occupational health side of our business? Wouldn't it be nice when we're doing our nursing and care services, so that if we're taking a picture each time of a post-operative care wound or some other wound management, and it can start tracking the percentage or ratio of colours, and if those colours change, the density, shape or size of a significant nature, it should automatically trigger an escalation. We have a full record of what's happening. We're not making a clinical decision. What we are doing is we're capturing and analysing the data that's, whether it's a vital sign of blood pressure, it's moving out of a tolerance level, it's moving out of a trigger, and automatically create an escalation and automatically create a trigger for someone to follow that up, and then a closed loop which automatically updates the care plan, which automatically assigns somebody to follow that up and then make sure that either what corrective action needs to happen or not. Then our other significant database that we're building at the time is our client care. Our clients, we know, have preferences. They might only want to have someone that speaks a certain language visit them, from a certain cultural background, from a certain gender. I only want Mary, who speaks French, who's a female, on Wednesdays and Thursdays to deliver that service. When the client rings up and says, look, by the way, I'd like to, Mary delivers physio, but I also need some massage. Can I get somebody out? Yeah, you might, in your manual days, go and find somebody else, and then 2 hours later send somebody else. But in Mary's profile in your system, it says she's not happy. She's happy to deliver physio services as well as massage services. So you're then right at that time, as the person either books the service online or does it via the phone, you can go straight back to them and say, well, actually, Mary, at your 10 a.m. appointment, can, following your physio, do a massage service. Would that suit you? Would you be happy with that as an example? So not only are you meeting the client's preferences, and the tool and the system is telling you that there's that opportunity. You're making things more efficient for Mary, and more efficient for your business. And lastly, how do we optimise our membership business? We know that's the cash flow for our business, and we know how many services and currently we're delivering via that membership program, or that subscription service, or that pay for visit service. How can the system predict and give us better estimations of how our business is tracking against our current model? Where is the capacity for us to drive more efficiency in the business versus otherwise? As I said, there's a whole host of things that artificial intelligence type tools today. Natural language processing. So we use the technology out of both Microsoft and Amazon so that you can dictate straight on your phone. So imagine someone checking in to deliver a service, and as they're delivering that service, they're talking to their phone, and the phone is capturing what they're saying and filling in vital signs if they aren't captured by some sort of remote device, and removing the burden of manual data entry, and then therefore automatically updating the care plan, the next of kin portal, meeting your audit requirements. Advanced analytics in our system is such a powerful way of measuring what's happening with our environment, measuring who are our best clients, who are our happiest clients, who are our most efficient deliverers of service, where's the most efficient routes, which services do we deliver are valued the most versus ones that aren't well used or well supported. How do we track our clients' wellness, and how do we provide value to them to say that not only are we tracking it, but if it goes out of certain tolerances, we can automatically intervene, either doing a video call to follow them up initially, and then automatically schedule follow-up visits or services. We're using virtual assistants and health and bots every day when we visit websites, and we've infused that technology to allow you to provide self-service to relatives, and for those clients that are familiar with using that sort of technology, they can start getting immediate access to information about themselves, information about services, and we can then tie in different information sources to provide more value to our engagement. So here's a busy slide, but what it's trying to show you is the complete sort of an example of I've got a carer who has a mobile app. We've got clients that have got devices at home, either wrist devices or Bluetooth devices that are capturing everything from weight and blood pressure, blood glucose, oxygen, movement, etc. So we're capturing all of these health metrics that are automatically being updated to their care plan, so that other clinicians and other people that are interested in this particular person can track how they're tracking, what their tolerance levels are. From a carer point of view, we're pushing out the route and tasks as well as their scheduling, and at the same time we're leveraging the capability of our scheduling, rostering and diary system to be able to optimize that route. Someone rings up and says, look, I've got a service on Thursday and I'd like to get another service. At the moment, you might be going to multiple diaries, multiple calendars, making phone calls, sending emails to coordinate how you're going to deliver that service. Wouldn't it be nice if the system already knew, could understand looking at everybody's online diary and availability, scheduling, their roster preferences, and automatically provide suggestions about who can deliver that service. And then the focus point is always optimized for how to deliver that service in the most efficient way. So we're pushing out and driving and supporting our carers so that they can do more without the burden of administrative. We've got a portal and a client app that allows clients to see what's happening regarding their care, and they can make changes to schedules, send updates, messages, to their care workers if there's anything that they want to talk to or chat about as well. At the same time, it's all going into a common, secure repository where we're tracking all of that various information. So let's look at some real-world examples. Here on the right-hand side, we've got a dashboard, and this dashboard's giving us an immediate snapshot of our operations. Which services are being consumed today, this week, next month. How does that fit in with our budget and revenue projections against our costs? What about service utilisation of care staff? Which customers are using the most number of services? If they're on a membership or a subscription or some sort of package, how do we go back to them and say, well, actually, you're only using 50% of your package today. How can we help you utilise other elements of your package so that you get more value out of it? No different to a gym membership. You get a gym membership that gives you multiple visits a week, and if you're not using it that week, or you soon want to go away from that gym membership because you're not getting any value. This way you can automatically go back to them and say, well, look, you're getting physio, but you've actually got enough in your membership package to get massage or transport services and so on and so forth. Let me take you to our budget calculator so I can show you how we can offer those additional services and roll that into a package that allows you to get more wellness and beneficial care based on our visit. If we're using these different range of people that meet your profile, they can deliver these other services while they deliver that one in particular. As I said, that integrated care, having a client app, having a next of kin or relative portal environment, and that carer app, so that to the carer, we can push out processes, videos, procedures, so that they can adapt and deliver different services within their skill set. If they don't know what to do, right at the app, they can pull up checklists for what they need to do if there's an incident and what have they got to capture. From a client app, they can see what vitals are being, what's in my health or wellness plan, and this is an example of a weight loss program. We've got some targets both in movement as well as actual activities that are going to support that weight loss program, and they can help track that and give as well as give assessments. As I said, getting the most out of your staff and giving them the tools that make their lives easier and more efficient. So automatically checking them in when they arrive to do a visit. The notes, the latest notes, progress notes, care plan has been updated. They know exactly what they need to do. They follow a checklist. As they don't need to type in, they just need to dictate into the phone to update any vital signs or any notes, so that that care plan, that audit, that wellness and health record is automatically updated. As they leave, they check out, they get whatever certification from the client that they're happy with the visit. Might even ask them for a quick, 5-star rating of the service. So we're automatically reducing their admin. As they're walking to the car, the app is telling them where they're going to next, how long it's going to take them, what's the next task that they're delivering. Do they need to pick anything up? Do they have all of the right stock? They don't need to think about those things because the system is already organised. If they need to do something at this visit and they didn't have it in the car, then it's already been dropped off by somebody else, or that's now there at the next appointment. From your business point of view, managing dozens or hundreds of staff and coordinating and delivering that based on different preferences of staff, different days of the week they want to work, different geographies, parts of the area that they want to only work in. How do you do all of that? And so, as I said, within this system, we have a comprehensive client database about all of the attributes and locations. We've got a very comprehensive carer and care deliverer, clinical and non-clinical database all of their attributes, where they like to work, when do they like to work, what are the qualities and attributes that they have from a language or cultural preferences. We've got an access to their roster and their diary. What have they opted in for? And so as these new requests come in, as requests come in to change things, we don't need to go and look at multiple diaries. We don't need to look at different, make different phone calls and email sessions. The system automatically goes ahead and tries to optimize the right person for the right service for the client's preferences. You know, if the client says, look, I'd rather not have the visit if I can't get Mary, then versus somebody else that Mary was going to see, let's see if we can swap Mary out as an example, because the other person isn't tied to the person, they're tied to the service. How do you do that in such a complex environment? And this is where artificial intelligence, using the power of that data that we've collected in the way that we've orchestrated that and infused that technology, means that you can get those efficiencies. Clearly, we've all sort of experienced Google and Apple real-time mapping software. So we've taken that paradigm, that Uber paradigm, and infused that into the platform so that at any one time we're optimizing the route. We're using courier-style business rules to get the most efficient route delivered, both with and meeting as many of the attributes that people have. Look, I only want to work in this particular area for this particular time, but I've got a lot of flexibility, and I'm happy to extend my day or reduce my day, etc. So with that and those multiple databases and the artificial intelligence engine, constantly re-evaluating things, re-evaluating preferences, and making recommendations for what is the most optimized piece, we can really see some significant value in that. I mentioned IoT. It's one of those buzzwords around Internet of Things. In our example, the Internet of Things says that at any time now, between a mobile smartphone, a smartwatch, or any of the Bluetooth devices, there pretty much isn't anything that we can't remotely monitor. Or we can do a video call. We can then monitor diabetes. We can move movement, alarm alerts, temperature, blood glucose, blood pressure, oxygen levels, etc. So in real time, with our mobile connected devices, we can update the care plan and then have a whole bunch of business rules sitting in the background, checking and validating and deciding whether, look, it's within tolerance, if it's out of tolerance, and if it's out of tolerance, what is the business rule? Contact a next of kin, escalate that for automatic and appointment, have a reassessment done, etc., etc., etc. So let's look at some, again, some real live screenshots. Here we've got our operation performance dashboard. There's a slightly different view about which services are being used. What's our ratio of visits? Where are our gaps? Where are our opening? Where's the activity happening for staff? Which staff are fully utilised? Which have got some further capacity? Where have we got some gaps that we need to? The system is saying, look, you know, we can't automatically allocate that one, but this is our recommendation. So it really gives us a powerful way to give us oversight. So we have a client view, so they can get a dashboard of themselves. Carers can see how they are fitting in, and then from an operational performance point of view, we've got various dashboards that look at the key performance indicators of your business. Is a particular service well used, very efficient, or are there other service categories that aren't very well used and over-resourced, as an example? So let's look at how we've used artificial intelligence and machine learning to provide a lot of capability. As I said, we've got a real focus on providing an extensive catalogue of services. So we capture all of those services with a whole host of attributes that describe those services. And in describing those services, it gives us the ability to create packages based on various combined sets of services or simple services, and then defining a whole host of eligibility rules. So for instance, if certain insurance companies fully pay for that service, or fully pay for those group of services that are as a package. And so by doing that, together with our carer database, our client database, our diary and rostering database, we can then both measure and the utilisation of both the care worker, the services and the packages, and then use those as a way of targeting and providing clients with a range of services in a packaged way that meets multiple elements, gives us a ability to grow our business and grow our interaction with that end client. So it gives us the ability to have very complex services with complex eligibility rules, and the artificial intelligence sits over the top that's orchestrating that. And then our data insights engine is giving us a lot of ability for us to see how well a service is being managed and consumed. From an activities point of view, we can start looking at which clients are using which activities, which services have been unassigned, which tasks or jobs for next week have not been able to be assigned. So right from a snapshot point of view, we can start looking at some various workbenches and optimise those workbenches to suit clients' requirements as well as our carer requirements. And when they're outside those parameters, as I said, a care worker might say, look, I can only work Wednesdays and Thursdays, but as a pinch with some notice, I can work on Mondays. This gives us the ability, right from that work list orientation, to coordinate those unassigned or difficult tasks. Secondly, as artificial intelligence improves, it means that now we can start optimising how the screen is displayed. If we know we're doing some tasks in a repetitive way, we don't need to push that whole screen to somebody when we only know that they're looking at the activity list and the billing pieces of that particular service. So it starts learning based on an individual's usage of the system to see what sort of information needs to be to drive a better user experience, help them get their job done more quickly. As I said, from our scheduling and rostering, having that learning engine, we can start seeing which services are used by which person and which carer delivers those services. Then we can start doing some learning of what are the repeatable things. And once we start to learn what the repeatable things, what are some common things, we can start doing some forward planning. What's going to happen next month? What does next month look like? What does the month after that look like? How does that fit in with school holidays or festivals and things like that? Do we need to get back to clients to remind them to say this is during a festival or holiday period where we've got that sort of issue? So a great example of how machine learning and artificial intelligence can help you start managing your business to drive customer and client satisfaction and keep delivering high quality services. As I said, having the ability to do intelligent rostering and scheduling means it's a great power to do and automate our rostering and scheduling, and then being able to look at unallocated tasks that the system hasn't found a gap, and then using the parameters that are in the system where there's flexibility to be able to automatically assign that through a drag and drop piece. And then I guess efficiencies around end-to-end integration. As I said, inventory, wound packs, diabetes kits, etc. All of these supplementary physical items can be attached to services, attached to a in-out system to be able to manage their location and their utilisation. So it gives you a greater ability to both automate to make sure that all services can be delivered with all the necessary tools required, right through to full management of all of those consumable and asset items. So that gives you a greater ability to control and manage your stock, either on hand or purchasing elements within your system. As I said, we don't, at any one time, we don't want to compromise quality at any particular time. And as I said, our history and background is around quality of care from a clinical point of view, and we've applied those same principles to our non-clinical services. So, as I said, from if a physio is about to do a visit and they've arrived and that person's had a fall, what do they need to do to manage that incident? We push out that information that automatically, as they collect that information about the incident, didn't require hospitalisation, didn't require an ambulance, but yeah, they were a bit shaken, they seem fine. But we want to be able to do meet the requirements of capturing what happened, what we did, and then have a full closed loop to meet our audit requirements and let our next of kin know that we saw that, we tracked that, we captured that, and we followed it up to make sure that it was all done and that the system has captured all of that information from both a historical point of view and from an auditing point of view. Sort of running out of time, but I guess I just wanted to leave you with, I guess, a high-level piece that we're focused on using technology and infusing that technology that we now take for granted in the many parts of our lives today, really to allow us to streamline those those business processes, enhance staff productivity, and give staff confidence that they now have the tools to focus on what they do best without all of the administrative burdens that you need to, or the administration that you need to happen to meet your auditing and drive reduce operational pieces so that people get the right bills. There's no wastage. We're driving efficiency. We're resource tracking. We're optimising our staff at the same time, not reducing our quality of care by having proactive focus on always improving our processes and so on and so forth. So I hope you've enjoyed today's session. I'll probably stop the recording now and then just open it up to questions. As I said, if there are any more questions, please go through your local office. Happy for you to send me an email as well. But I hope you've enjoyed the session as much as I've enjoyed delivering it.